Greetings. Thank you for tuning in to the Manifest Wellness Podcast. Today, I'm joined by Dr. Janelle Green. She is a foot doctor and foot surgeon, and she's also a plant-based nutrition coach for people with uncontrolled type 2 diabetes. We're going to learn more from her about her journey to her work and what she's doing and why it's so critical during these times to help people with uncontrolled type 2 diabetes and also others who may have diabetes or know someone in their family. So Janelle, I wanted to ask you a little bit about yourself, kind of what led you on this path to become a podiatrist and a foot surgeon, and then also a nutrition coach, because it's like sort of one of my favorite quotes is the road less traveled. You know, there are not a lot of you. People say that about me, but there are even less people like you who are doctors and, surgeons. So I'm really interested in your path and what inspired you.
Absolutely. Yeah, no, I am a podiatric plant-based podiatrist surgeon. I guess you could sum that up. And I love it. And there's like a whole world out there for me to practice and work and share my knowledge. How I started off in this area, I always wanted to be a doctor. I really enjoy working with my hands. And so I learned about podiatry through actually getting some information in the mail. And at the time I had a family member who was working with some podiatrists. And so I got a chance to shadow podiatrists and really see how they worked a lot with their hands. They had the opportunity to perform surgeries. That was amazing for me being, a young up and coming. I was in college at the time, just to learn about, the world of being in the operating room. It just happened to coincide with the time in my life and my family's life when a family member was suffering from uncontrolled. She had type 2 diabetes, but she was also a smoker, and she was at risk of losing a limb. And it's a sad story because she ended up losing her life because she did not want to lose a limb. She was like, I'm not going to get my leg cut off. And the infection that I have in my foot is going to spread through my body. And I have made a conscious decision to go with whatever happens. And unfortunately, she ended up passing away. And so as I was learning about the field of podiatry, this is before I started school, and just experiencing that in our family, it was my goal to teach people that you could lose a limb, which is still true. I still believe that. And I see it every day, and have a wonderful life, spending time with loved ones and doing the things that you really still enjoy for the most part. You can still do a lot with having lost a toe, unfortunately, or a leg, but you'll be here. And so that was my goal, and when I went into podiatry school, I was going to teach my clients, teach my patients that they could have great lives, even if they had to lose a limb. My primary objective as a podiatrist was to keep them from having to lose a limb. So I would actually, perform any palliative treatment, provide necessary shoe gear, provide them with antibiotics, whatever they needed to keep them from losing a limb. That's the first goal. And then if you have to go on and perform surgery, I would do that. And that was fun for me. I really enjoyed it. It was energizing. I thrived. I love my patients. I love my working environment. And so I did that. And I actually taught at a university, at Western University, for 7 years in that process. So I got a chance to work with students, and students, not just at our school. We had some students come from Texas a few times, in different parts of the country, that were interested in learning about podiatry. And so I got a chance to show them how to, gown and glove is what we call it, and go into the operating room and, scrub and get your hands and nails all clean. And so I love that. I enjoy that environment. And I eventually ended up leaving and coming back to San Francisco to be with family and going to private practice. And I was in a community that had a lot of people that were not diabetic, but that were in their 70s and 80s and doing extremely well in their lives in terms of their physical health. They were teaching physical therapy classes at 80, having clients, very limber, moving, walking, doing a lot of physical activities. Their minds were healthy. A lot of them, didn't have to use canes. They didn't need ambulatory devices. And, as a podiatrist, one of the things that I really enjoy about it is when I'm doing my work, whether it be an injection or helping someone with the callus, I get a chance to look at my patients in the face, and we talk. And so I talk to them a lot about, what's your life like? Where'd you go to dinner last night? Those are the types of conversations we had, and, about their gardens. And so they began to tell me about not only the physical activity that they did. A lot of them, were 80 doing yoga. They grew things out of their garden. They ate a lot of vegetables and fruit, a lot of whole foods. And so that really helped me to see life at that age through a different lens. Because in the community that I grew up in, when someone got to be, if they made it to their 70s, they really didn't have a thriving life. I'll say many people are using canes and walkers and just having a hard time getting around. And so it was a striking contrast to the community that I was in, where people were in their 70s and 80s and swimming and riding bikes and doing yoga. And so I learned about a holistic approach to well-being. And so I began to explore that a little bit more. I've always been inquisitive, so I've always kind of wanted to know more about that type of lifestyle as it relates to healthcare. But the more I learned, the more I realized there was a lot that I didn't know about a holistic lifestyle and how that can benefit someone and benefit someone's well-being. I learned a lot about nutrition. I took biochemistry in school, but I didn't learn about nutrition and exactly how the food affects our bodies on a cellular level. And so from talking to them, I took classes and I got a coach and enrolled in a certification program to become certified in plant-based nutrition. And so that's how my knowledge expanded, because I realized that in order for me to truly keep people healthy and walking on their feet as a podiatrist, they needed to be eating healthy too. It's not just about what happens in the feet. And so that's how the whole nutrition plays into that. And I specifically work with people that have uncontrolled type 2 diabetes, but a healthy, holistic lifestyle with healthy nutritional foods can benefit anybody who decides to take that approach in their life.
Yes. Yes. And another quote that I hear you share is, I want all the people around me looking good and feeling good. What does that mean to you? I think that's very important.
Yeah, well, exactly, exactly what it is. I when you say that, it just kind of sits with my soul. And the reason why I enjoy that quote so much, it actually comes from a song from a group out of Philadelphia. But why I enjoy that so much is because we're all here with a purpose and something to do. And it's important to me that everybody who wants to do that is capable of doing that. And we need physical health in order to accomplish those things. You're an executive coach, or executive wellness coach. And so you can truly understand the importance of having wellness in the workplace and just being able to get your job done there. And so that is important to me. It's important inside of work and it's important outside of work. And so when you feel good, you look good. And, it doesn't even matter what you have on, but when you feel good, you radiate good energy, you radiate happiness and joy. Even the smile on your face is so much more powerful than possibly the best dressed person out there. And when you look good and you feel good, then you can really contribute to your community. And that's what it's about. Contribute to your community, contribute to your household and the people that are around you, because we all have something to give and share.
That's critical. When I was thinking about that quote, I thought about too how, when we decide to activate our wellness and get well, um, it's good for one individual to have their wellness intact. But if you have people that are around you, your loved ones, you want them to be well also. So that's going to impact the success of with how you feel long term, with your mind, body, and soul wellness. Wouldn't it be amazing if everyone in your community was experiencing wellness?
Absolutely. One of the other things that I wanted to mention is you and I have talked a lot about type 2 diabetes, and we talked about sugar as it relates to type 2 diabetes. But one of the other things that I wanted to talk about is saturated fat. So if we have a quick minute, and one of the things that I want people to understand is that the problem with saturated fat is that's really the driver of something called insulin resistance. So insulin resistance is something that if you have type 2 diabetes that you should probably understand. And basically what it is insulin is you can think of it as a car. It's the thing that carries the sugar into your muscle, into your liver. You need your muscles, because you have muscles, you have eye muscles, muscles around your mouth, you have muscles all over your body. It's what helps us move. Your muscles need that energy need that glucose to convert it to energy for us to move. Okay. Insulin is the thing that carries that sugar into our muscle cells, into our liver, so that they can work properly. So we need that glucose. That's not a bad thing. So it's important. That's one thing to understand. Insulin resistance happens when that insulin car just doesn't work anymore and stops carrying that sugar into our muscle and our liver cells. And what happens is that sugar accumulates in our bodies. And that's when we get high levels of blood sugar. That's when the sugar accumulates, we get dehydration from our nerves and our blood vessels. So sugar is a preservative. So anything that happens in that canning jar when you go to preserve your fruits and vegetables, and it kind of dehydrates them. Your fruit. It dehydrates your fruit so it can last a little longer. That dehydration process is happening in our blood vessels, and it's causing them to have problems in our nerves. For people with type 2, even, you don't necessarily have to have a diagnosis of type 2 diabetes to have elevated blood sugar, but that elevated blood sugar is causing all of these symptoms. That is triggered by a diet high in fat. So that's one of the misconceptions, and that's one of the things that I want people to understand. A diet high in saturated fat, which is primarily sources of meat, eggs, and dairy, provides that fat blocks the insulin from bringing the glucose into our muscle cells. So if we think of our muscle as like a building, a building or some type of building that we need to get inside. We need to get inside this building. It could be a club, it could be a church, it could be a grocery store. If you think of your cells as a building, and the insulin is the car that needs to get into the building, if you've consumed a diet high in saturated fat, that door to that building is going to be jammed. It's going to be blocked. And the glucose with the insulin cannot get into the building, cannot get into the muscle cells, cannot get into the liver cells. When that glucose can't get in, then your blood sugar elevates even more. So a lot of times people want to cut out sugar from their diet, but it's really the fat that's blocking the sugar from getting in. And so removing things from your diet that are high in saturated fats is going to be key if you are someone that's suffering from type 2 diabetes, because a diet high in saturated fat in the long term perpetuates insulin. A lot of times people will consume a diet high in meat, eggs, and dairy, and they will eliminate carbs. In the short term, that does help to drop your blood sugar. In the short term, that does help with weight loss. However, in the long term, that perpetuates insulin resistance all over the body. So anywhere you have a muscle that needs the glucose to get in is going to be blocked because of the saturated fat. So like I said, immediately people might see results with weight loss. They might see their blood drop quickly, or their blood sugar drop quickly. However, in the long term, it leads to a path of insulin resistance, which will eventually result in development of type 2 diabetes. In addition to that, that diet high in saturated fat contributes to heart disease, which is the #1 killer in this country. So it's really important for me that people understand the link between a diet that's high in saturated fat and type 2 diabetes.
That's critical. Can you explain a little bit more about what is insulin?
Yeah, so insulin is a hormone, and it's made by the pancreas. And it's a hormone. It's made by the pancreas, and its job is to carry glucose into our cells. So people with type 2 diabetes that have had high levels of blood sugar, eventually their insulin gets overburdened. So they're trying to get this sugar into the cells, and it just breaks down. And so you could say that insulin car just breaks down. So insulin is a hormone whose job is to get sugar into our muscles and our liver cells.
What were some of the challenges on the road to becoming a doctor?
I think the biggest challenge, a lot of times it happens in our mind, is me believing, right, that I could be a doctor. Being in an environment, the workload was the first time where I actually had a consistent periods where I felt like I needed to stay up for 24 hours to really get that material down. The challenges of just kind of being in a new environment, learning how to balance being on the floors, because as part of my training as a student, we go to the hospitals for part of the time. And this is starting in our second year. We go to the hospitals for part of the time, and then part of the time is spent doing work. And just having to balance all of that and balance the things that I was seeing, I had to really train my mind to see sickness from a different perspective as a healthcare provider. So that was definitely a challenge. It was also when I went to a podiatry school, the first time that I was the only Black woman in my class and in any setting that I had ever been in. And so that was a challenge for me. There were times where I felt like, I didn't have people that could relate to maybe some of the struggles that I was experiencing. And so there were many challenges along the way. So there were academic challenges, personal challenges, just kind of being in an environment where you kind of feel like you're the only one. There was imposter syndrome, a challenge that I had to deal with. And then, what recently, I don't know if it was Brene Brown or if it was someone else, but they talked about imposter syndrome, and the perspective that they gave was that we've created a culture for people to have imposter syndrome, because we've created a culture where certain people that look a certain way, at least historically, were not supposed to be doing certain things. So the fact that, I had imposter syndrome and many other people is not an accident. And that was really eye-opening for me, because it kind of released me to kind of feel that and then let it go, to feel that, oh, this was by design that I feel this way. Let me let it go, just kind of dealing with that. And there were a lot of challenges. I did my residency on the East Coast, and just being on the East Coast, I'm a Cali girl. And so being out there in the snow and residency, and just kind of learning how to command an operating room and being the surgeon. That was the time when I was in residency. I was like the surgeon. This was my surgical case, and I wasn't relying on anybody for the wellness of my patient. And just having that responsibility, it was great. It's an amazing feeling. but it's definitely something that, I had to grow into. So that was a challenge. And then came, marriage and children. And so I still have challenges along the way in this profession.
That's amazing. Yes. Unique challenges. That's great. Balancing it all. So what are some of the things that help you? I know we talked about, the things that I encourage my clients to do, but what help you balance all those challenges and get to where you are today?
So one of the things was really, I learned, I guess this was, around 2009, 2010, I think maybe before it became big, at least in my circle of people, is doing affirmations. So I just knew I needed some positive self-talk. So I would stand in the mirror and I would encourage myself. I would say positive things to myself. You can do it. You can pass these board exams. You can be confident. You are confident. And so that was one of the things that really, helped me along the way. And I remember talking to a family member about it at that time. And she's like, so what do you do? Just stand in the mirror and talk to yourself? I'm like, yeah, that's pretty much, And then I learned more about meditation. I definitely had a therapist along the way at different points in my life to kind of help me exercise. I learned how to exercise. And how the benefits of exercise and how that releases serotonin, and it's a feel-good hormone to kind of make me feel good and get more energy. I really relied on my community. They were very helpful to me during those times. And one of the things that someone recently said to me, though, they said, you don't want to balance your life. You want to integrate everything. And so I'm playing with that idea in my mind, because as I'm a mother, as I'm a wife and sister and a caregiver and aunt and all these different things, I'm wondering, how can I intermarry or intermingle those things in order for my car, my vehicle, my life to run more smoothly and succinctly. And what I'm finding is that some things can be integrated sometimes. It's just about having the wisdom to know when that's possible. So for example, in my private practice, there were a lot of times where there were no camps available, or, we didn't get into camp for my children. They were out of school. And so they had to come with me into the office. And so how do I incorporate them in the office space? And, having the wisdom to know which patients might be okay with that, and talking to my patients, because at the time my daughter was 5 and she was inquisitive and wanted to know what was going on. And so sometimes I was able to make a teaching opportunity out of it for my patient and my daughter. But just, it's balancing it. And then I'm also figuring out how can I integrate some things as well.
That sounds really good. It sounds like you're making it a lifestyle, We're not resisting, but making it a life, designing a lifestyle that you want. So we're going to go ahead and conclude. Let people know how they can reach you.
I'm Dr. Janelle Green, podiatrist and whole foods plant-based nutrition coach. If you have uncontrolled type 2 diabetes and are suffering from limb loss, or you're at risk of limb loss, or you have a friend or family member, please reach out, www.drjanellegreen.com, or you can send me an email, dr.janellegreen@gmail.com. And that's green, just like the color, with no E.
Thank you. Live a life of purpose with gratitude, visualization, and community.
Wonderful.